Today on Medical Montana, I'm back in Great Falls here at Rocky Mountain Vein Clinic. I'm meeting with Dr. Orcutt. Doctor, it's good to see you.
Thanks for coming.
I want to talk about the symptoms that relate to vein disease because there seems to be a lot of confusion about it.
The most typical symptoms are heaviness, aching, throbbing, burning, sometimes cramps. Sometimes patients come in describing some quite vague symptoms that they don't really correlate with their varicose veins. And the most typical thing that I see along those lines are patients tell me that they just have a heavy, achy, tired sensation, and it's especially common toward the end of a long work day, or if they spend a lot of time in the kitchen preparing meals for like a holiday. And a lot of those patients just find that they have to sit down and put their legs up just to feel better.
Sure. Now, so if I have a job where I'm on my feet all day, particularly on a hard surface, over time during the day, that heaviness would increase, and that could be a sign.
It could be. And of course, people that are on their feet on a hard surface all day long could expect to have heavy, achy, tired legs. But if they have varicose veins, the symptoms are usually much greater. And then when we treat those patients for their varicose vein problems, most of them are surprised at how much better their legs feel. And they had no idea that they could feel that good because their varicose vein related symptoms have been coming on for so long.
Sure. Now also, one of the things that can make it hard to diagnose is you may not, although you're experiencing some of those symptoms, you may not visibly see anything.
That's true. The varicose veins that you can see are those veins that are immediately under the skin.
Right.
But you can certainly have varicose veins that aren't readily visible. They'll be just a little bit deeper, but still varicose veins. So it's very common for me to have patients that have some varicose veins that are very visible in one leg, but not so obvious in the other leg, and yet they have the same problem.
Sure.
And we diagnose that with ultrasound.
So I guess the moral of the story is if you're experiencing continual pain or throbbing or some of these symptoms in your legs, it's time to come and see you.
It'd be a good idea.
Thanks for the time.
Thank you.